Hi, everybody. So this is, I guess, the first time that we've ever had a talk about animal health technology, and I thank you guys for coming. This is a really good turnout. So I don't know if any of you know what animal health technology is, but we'll go into that. We're pretty much animal nurses. We deal with different kinds of animals every day, depending what practice you're in. And I'll just explain what the program is about, what possibilities you have as a career as an animal health technologist, and the type of things that we go through on a daily basis. So just so you guys can see what's going on here, this is actually pictures from when I was in school a couple years ago. I graduated in 2010. And we work with reptiles, so we've gone to the zoo and kind of gone behind the scenes. So there's a tortoise there, me petting a tortoise. And also we do practicums in surgery as well, so we do assist a veterinarian, so that's me giving a thumbs up in surgery. And just me with a puppy at my clinic for one of my friends here, so, okay. Okay, so just a little bit about myself here. So I got into the program in 2010. I actually waited 10 years to find this program. And I originally wanted to be a marine biologist, and in Manitoba we don't have any oceans nearby. So this was something that I kind of stumbled upon after doing research for about 10 years and found out that this program has been around a long time. And I definitely know that working with animals was something that I wanted to do. I just didn't know how to go about doing it. And I'm also part of this committee for the CAT committee. We'll just shorten that, for Animal Health Technologists of Canada. And my primary job on this board is to make sure that technologists get recognized in Canada and actually get the recognition from veterinarians and from people that our jobs are pretty phenomenal, and I hope to do wonders with being on this committee. And actually, I'll go back a slide here. These are my two cats. I used to be a dog person until I stumbled upon cats, and they're a little bit easier to take care of with my busy profession. Ranja, the orange cat, actually is one of the two clinic cats that we had at our clinic. Pretty obnoxious when it came to other animals, didn't like dogs very much. So I took him home, and he's a lot better there. Skeletor, my black and white cat, he's not very skinny, but that's the name that he came with. He actually came in, and he was pretty much in cardiac arrest. And we resuscitated him and hospitalized him for 10 days, and his owners left him there. So what I did was I took him home, and now he's one of my favorite cats in the whole world. So I'm glad that I got to take him home with me that day. Okay, so I'm part of a group of hospitals. There are hospitals in the city that are owned by multiple doctors. I'm part of the Henderson group. Fort Garry opened their doors in 2010, and we currently have 6 clinics in the city right now. Stonewall is actually in Stonewall, Manitoba. They used to do large animal. They don't do large animal anymore. And we just took on another hospital, Sage Creek Animal Hospital, newly built hospital in Sage Creek. And they primarily look at exotics and avian. So that's something that we added to our group of doctors. So it's pretty phenomenal that if I ever get to work there, that I'll actually get to see some reptiles and some exotics that we don't normally see on a daily basis. I'll just let you know, in this group of 6 clinics, we employ 17 veterinarians, 22 technologists, 15 assistants, and 16 receptionists, and we're still understaffed. So we are looking for people to come into these programs and definitely help us out, technicians being the most important role in all 6. We can do it with our support staff, but the technicians are the ones that the veterinarians need to continue on with hospitalizations, with treatments, and be their assistants on a daily basis. So we need you guys to come and apply and be technologists like me. Okay, so you guys all probably have pets, and you've probably taken them to a number of different practices in the city, depending on where you live. There are 3 practicums that you need to do in your program, depending on what time of year it is. The first practicum is just to get a feel of what a hospital is. If you've never been in a hospital, if you don't currently work at one, and you get to use your skills, and obviously you have to get credits in order to go. So I went to Birchwood Animal Hospital, and lucky for me, I worked in a hospital a year into this program, so I had some sort of experience, but 5 doctors, 5 technicians, and ongoing appointments all day. I got a ton of experience. Dr. Schott at Birchwood Animal Hospital actually is specialized in ultrasound. So he was very busy with that, and I got a chance to go in with him and do an ultrasound on the heart on a greyhound. So that was really nice to see, something different you don't see every day. And your second practicum is a surgery practicum. So they teach you surgical prep, asepsis in school, and then you go into a clinic and learn how to do surgical prep, monitor anesthesia, figure out your medications that you need to give safe anesthesia. And so I did that for, I know it's changed, but I did that over a 3 or 4 month period. For my last practicum, you get to choose wherever you want to go. It could be large animal, small animal. I chose to go a different route. I don't think anybody else in the program had done this before, but I chose to go into 2 government agencies. You don't think that technicians are actually can be in these programs, but they're the ones that actually run these programs. So the CFIA, Canadian Food Inspection Agency, they primarily deal with meat, birds, chickens, and we went and did inspections on where the meat is butchered, I guess you can say, and provided for us. And we also got to go to a domesticated elk farm in Woodridge, Manitoba. And if you think about elk, deer is about this big, elk is this big, you can't touch elk. So we had to find a way to get them into an enclosed area to actually take blood samples from them. So think about that. That was a whole day process. But we managed to take blood off of them and test them for tuberculosis. And when they all came back negative, we had to do it all again and vaccinate them for tuberculosis. So that was pretty interesting. What we also did was I actually did a honeybee inspection. You don't think that we do honeybees, but we do actually look at that as well. And we made sure that that the honeybees were safe when they came into the country from California, and that they had the right amount of space to move in, that they had food and water, and that they were all alive. So there is honeybees, honeybee farms in Manitoba, so that was something that came in as well. At the Foreign Animal Disease Center, what we did there was, it's a lab research facility. Obviously, they're looking at diseases, so these animals are inoculated with viruses that we currently get. They use these animals because they have the same genetic makeup that we have, and they would provide the same symptoms that we would if we were to get infected with these diseases. They have 2 sides to this center. I got to work in both. The first side was with small animals, so mice, gerbils, New Zealand white rabbits, hamsters, and we did some blood sampling on them. On the other side, you're in biohazard level 3. So if you could think about that for a second, you're in containment for 8 hours a day. You don't leave containment. If you leave containment, you can't go back in. And the animals that were in there are all large animals. So we dealt with pigs, sheep, chickens, and goats, and they were infected with the herpes virus, West Nile virus, the avian flu. And they do have monkeys there as well. That's biohazard level 4. You have to be able to pass. You have to be tuberculosis tested before going in there because we can actually give them TB. So that's something that I wasn't allowed to go into, but our main objective as technicians in those areas is to make sure that the animals are happy, even if they are in a research room all day long. We provide them interaction, we play with them, and environmental enrichment, we give them toys to play with. So that was our main jobs with them on a daily basis, and they seemed pretty happy while they were there, but they have a greater purpose, and it's to make sure that we have vaccines made for us in case that endemic does happen. And so an animal health technologist is an individual that provides technical support to veterinarians by caring for animals and assisting in diagnosis and the treatment of animal health disorders. So it's pretty much like if you go into a clinic, the first person you're going to see is probably an animal health tech. They're the ones that answer all your questions. give you advice on food, training, behavior with your pet. They're the ones that are going to try and help you get your pet healthy if they're sick. And veterinarians are there to definitely give us a diagnosis to make sure that they're okay, but we're there just to assist them in anything that they need. So this is a little bit about the program. I don't know if any of you have looked into the animal health technology program. So you don't have to have any university credits, but if you do take university sciences, you can actually challenge the courses such as chemistry and anatomy and physiology, and actually don't have to take the courses. But if you guys are still in high school, which you guys probably are, you need a completion of grade 12, and you have to have one of Bio 30S. You have to have a chemistry 40S or chemistry 40S or specialized math. And I know some of you probably didn't take a Bio 30S, but you took a 40S. They've recently changed it to 30S because 30S actually is where you learn all about anatomy and physiology, which is the basis of this program. And as you can see too, there's a ton of courses in this program, and they all have lab components to them, so it's a pretty heavy-duty course load for 2 years. And you also need 72 hours of small animal volunteer work, so volunteering in a vet clinic, which vet clinics need all the time. So if you want to get experience under your belt, that's a good way to do that. And you also can do you need to do 8 hours of large animals. So, I mean, you could, if you have a friend with a farm, you can work on their farm for 8 hours and get some experience with large animals. Or I went to Miracle Ranch and cleaned stalls for 8 hours and moved horses and fed them, and probably the hardest work I've ever done in the last 5 years, but it's definitely worth it in the end because this program is pretty phenomenal. And you have to really be ready to work hard. So you're in the program 8 hours a day for 2 years, and you have to be ready to go home and do at least 4 hours of homework. So I mean, it's pretty extensive. Some courses in Canada are 3 years. They specialize more in lab animal or exotics. We're trying to get that here as well. We're trying to get the facilities to do that. But right now, we're sticking it with 2 years, and it's probably the hardest 2 years I've had. But it was definitely worth it. So think about it, and hopefully you guys come into the program. Okay, so number of things. I already talked about a bunch of things that you could do with your diploma. And one of the things that I want to touch on is rescue work. Rescue work, I have a friend who's in Nepal right now, and she's doing a Vet Technicians Without Borders program. She's there for a month, and she's doing a spay and neuter clinic out there. So that's completely volunteer, so just so you're aware of that. But you do fundraise to go there, but what you're taking out of it is that we're pretty fortunate here to have all of our animals spayed and neutered. In third world countries, the majority is like 6 to 1. So 6 animals to 1 person, and they're roaming the streets. And so you can go and do these programs and make a difference. The zoo, our zoo isn't very big. So if you think about it, there's only about 1.5 technicians that work at the zoo. But if, you know, based on funding in larger cities, you'll be able to work at the zoo there as technicians. Government, we talked about that. And you can also go and do pet health insurance. Technicians are there looking over claims to make sure that everything is correct based on the medicals that the doctors send into them. You can also be representatives of our veterinary brand foods. And you can also be a pharmaceutical rep. So all the medication that your dogs and cats get, there is a representative, and most of them are science majors or they are animal health technologists as well. You can be a practice manager like myself. Diagnostics, we do have a vet lab in Manitoba. It's at U of M, and they do further testing for us on Lyme disease. They look at tissue samples, histopathology. So if that's something that you're really interested in, working under the microscope and looking at cancer cells or anemia or anything like that, that's definitely a good place to go. And specializing. So specializing meaning you can specialize in canine rehabilitation. You can specialize in acupuncture, you can specialize in anesthesia, pretty much anything that this program can give you as a basis you can specialize in. In Canada, we're still trying to get it more recognized so that specialized technicians get a higher paying wage than a regular technician. So we're working on that. The US is definitely has a one-up on us there. They are a larger group of veterinary clinics and associations that can fund for specialized techs. Right now, because we're all privately funded by the veterinarians in our business, it's a little bit harder, but we're working on that too. Okay, so daily duties of an AHT, there's a lot on this board. We're nurses. We handle and restrain animals on a daily basis. We are taught to do x-rays. And if you think about it, x-rays on an awake pet. So it's not always hard to hold a pet who's in pain, awake, on an x-ray table to take an x-ray. So it's a skill that you develop. We also look at lab samples. We look at blood work. We also assist the veterinarian in surgery, prepping, recovering, and we also do treatments, vaccinations under supervision. And we also do tattoos and microchipping. Some places still do hoof trimming. I've never trimmed a hoof before, so because I'm primarily small animal. But in large animal, that's something that you'll be doing quite often. We also talk to clients about nutrition and home care. So everything that you need to know, we can give you all the answers for that based on what's going on with your pet. And we also do dental cleanings. Obviously, the pet is asleep for a dental cleaning. You don't want to do a dental cleaning on an awake pet because they'll probably try to bite you. So some people don't understand that a pet needs to be asleep in order for us to do a thorough cleaning. And we also do extractions. So we do take out teeth as long as the veterinarian is on site. And like myself, you can also go into management as well and clerical duties. Okay. Nutrition counseling. So this is something that everybody always has a question about when they come in. Am I feeding the right food? We're scientifically trained to the molecule as to why this ingredient is in this food that we are representing at our clinics. All the food at veterinary clinics are 100% guaranteed. So if we recommend a food to you, it's based on the age of your pet, and any illnesses it has. Is it growing? Is it sick? And if it doesn't work, and your pet doesn't even like the shape of the kibble, if your pet doesn't like the smell of it, you can bring it back and we'll try something else. It's guaranteed because it's been researched for years. I actually had a chance to go to the Medi-Cal Royal Canin plant in Guelph, Ontario a couple months ago, and every sample coming in had to be tested 20 different ways. And if it didn't match the genetic makeup of the actual ingredient that was in the plant, it was refused. So if you think about it, what we put into our bodies makes you wonder a little bit about what kind of standards our food has. Well, veterinary brand standards are a lot higher than ours. It's not expensive. Some people think it's going to be really expensive. It's not expensive, especially if it's a guaranteed product. So we want to make sure that your pets are on the right track, especially if they are growing puppies. We want them to develop into these healthy adults. So that's something that we deal with on a daily basis. Nursing care and rehabilitation. If you've ever had a pet that was hospitalized for many days, this is something that the technicians do probably every 2 to 3 hours. We're looking at temperature, rest rate, heart rate, and because pets can't tell us what's wrong, especially if they are in pain, these 3 indications will let us know if they are in pain. So if they're panting, it usually means that they are in pain and we have to give them more pain medication. Even though they don't look like they are in pain. That's something that will tell us that. Heart rate will also tell us that as well. If it's a very fast heart rate, it could be stress. So it could be something in the clinic or something that someone's doing that is stressing them out. So we may have to move them to another clinic, or they also may need more medication. Some animals are more stressed out in a clinic in general, so sometimes they need sedation. So that's something we look at as well. Temperature, obviously we're looking for fever, and we're also looking for shock. So anything less than 36 degrees Celsius, they're in shock, and we have to do emergency procedures to make sure that they get back to a right temperature. We look at, are they able to move? Are they walking around? Are they eating? How much are they eating? Is there any blood in their stool? Is there blood in their feces? Is there any blood in their urine? How much are they peeing? How little are they peeing? So we look at every little bit because the animal can't tell us that. We have to go based on their symptoms and what they're doing to really see if we can help this pet get back to normal. The veterinarians rely on us to give them these indications every day, and then they can do an evaluation after that. Restraint and safety, some of your pets probably aren't very nice when they come into a vet clinic. So we do have to use certain devices like muzzles to help calm them down. And that's pretty much what they're doing. And the secondary is so that we don't get bit. Muzzles aren't something that we like to use. Less restraint is usually better, but I mean, not every pet likes having their feet touched, especially if they are in pain. They don't like walking around if their leg is broken, but we have to see it. If they're gonna try and bite us, we do need to muzzle them, and we do need to hold them in a correct way so the doctor can examine them properly. There are more extreme kinds of restraint, such as cat bags, catcher poles. You've probably seen that with some like animal protection officers who have to catch a dog who's trying to bite them. It's a long pole with a string on it, and that's just for their safety. So we have one in the clinic. We never used it, but that's just in case. But most of the times, muzzles do well. And the restraint and safety is to ensure that your veterinarian doesn't get bit. We don't get bit or scratched, and whoever's doing the diagnostic procedure doesn't get bit. But I have my share of wounds that are healing, but you know, it's not like we're used to getting bit or scratched, but it's something that we try to avoid all the time. And the other thing is everyone in a vet clinic is usually vaccinated against rabies, even though we don't see rabies in a clinic in our animals here in Manitoba, but it's something just as a safety feature as well. So behavior. Sometimes a dog will come in and it looks like that Chihuahua right there. And the owner wants us to look in its ear. Well, I'm not gonna go up to a Chihuahua who's growling at me and look in his ear because he's probably gonna try and bite me. So we usually look at behavior first, and sometimes these animals do need sedation for us to actually do a really good physical exam on them. Cats, not everybody's comfortable handling cats, but this cat right here is not common. That's just sometimes. So we do have to be careful about that as well, but we do assess what kind of behavior they have. And most people think that aggressive animals are actually more of a threat than a scared animal. It's reversed. A scared animal is going to work on adrenaline, and that means that they almost do not have any rationale about what's going on, and they will probably want to attack you more than an aggressive animal would be. So we kind of look at that. We look at how their ears are, how their tail is, if they're backing up from us. And most cases, if this is happening, then we do have to forewarn all staff that this is going to happen and just to be careful. So we are a little bit more cautious with that as well. Lab work and diagnostics. This is just a greyhound that's getting a blood sample pulled. Greyhounds, they're a little bit bigger than most dogs. So we're able to get samples from them pretty quickly. But sometimes with cats and small dogs, it's not as easy. But we do look at urine under the microscope. We look at feces under the microscope. We look at worms. So much fun looking at worms. We look at ear mites, and we look at the cells as well. So we're able to look at the cells and see if they're cancerous, how many cells there are. Is there an infection? Is there not that many cells? So does this dog need a blood transfusion? Like, we look at all that, and we're able to give the doctor a diagnosis. Usually the doctor will hand all the lab work to us, and we're able to turn it into something they can use and give them a diagnosis and treatments as well. And we'll talk a little bit about euthanasia. It's probably one of the reasons why people do not come into this field is because they have to watch an animal being euthanized. I've seen a lot of animals being euthanized, from puppies to old animals, to really healthy animals, to really sick animals. So there's a lot of different scenarios. Most of the time in a vet clinic, what you're dealing with is financial reasons as to why a pet is being euthanized. It's pretty sad that people who have pets can't afford to have pets, especially if they are sick and they need to be euthanized for a humane purpose. We always have to consider what's best for the pet, regardless of what we feel. And a lot of times, people will come in with an animal that's been suffering for years. It can't walk, it can't eat, it has no muscle mass, its stomach is bloated, and they want to keep the pet around for their companionship when the pet is sitting there suffering. In these cases, the veterinarian must intervene because it is inhumane to keep an animal alive for your benefit. And sometimes, not every veterinarian as well, some people actually want their healthy pet euthanized because they're moving, because their daughter is allergic to their pet, or it doesn't get along with their other pet. It's healthy, it's young. We have the opportunity to actually ask the owners to surrender these healthy pets, and usually they're young pets, and we'll find a home for them. So, I mean, there are options out there. Euthanasia isn't something that we like to do, but sometimes when the pet is really sick, it's probably the best for them. But we always think about what's best for them, and we have to be considerate and respectful of what the owner wants to do as well with their pet. Okay, so what makes a good AHT? Obviously, you have to be compassionate. You have to love your job. There's some days I come in and I really don't want to be there. I didn't sleep at all. And then you walk into a room and there's a puppy, and everything changes. The world's a better place because this puppy loves you. And it makes you want to keep going, and it gives you the motivation to want to do this every day. The best part about this job is you see a puppy one day, it comes in 3 months later and it remembers who you are. Puppies, like cats, dogs, they have that trait that actually helps them to remember something good and something bad. And you probably have noticed it with your pets. Some pets don't like going down the stairs because they maybe have fallen down the stairs. So they're really hesitant to want to go down the stairs for the rest of their life. With good things, especially coming to a vet clinic where they get poked, their temperature, they get examined. It's always not a good environment, but if they're happy to see us and they let us do that, it's a lot easier on us. But you also have to be confident and outgoing. You have to want to talk to people. A lot of people that come into the program all they want to do is just work with animals. That's not all that your job is. It's working with the people that own these animals. It's working with the farmers that are working with their cattle. And you have to definitely be a confident person, an outgoing person to do this job. Obviously, well educated, that's what school is for. School will give you the basics, but what you take with it afterwards and the experience that you gain depending on where you go in the city or in the world will definitely look better on you. Open-minded, obviously, there's a ton of things that you're going to see. So you will, in the program, go into a pig barn. You will go to an auction house. You will go and deal with chickens. And a lot of people who are really like vegetarians or like against like abuse of animals or any sort of harm to animals in those settings, this is probably a good way for you to actually get an opinion because you're actually being taught what's right and wrong, especially when you're handling the animals. So it is a good way to really see things in a different way. You have to be ambitious, great communication skills, great technical skills, and a veterinarian always likes when you anticipate what he's going to do next, or she next. So we really want to make sure that we know exactly what's going on. In case of an emergency, you know exactly what's going to happen. If you're 2 steps ahead of your doctor, that makes it easier on them to get treatments ready and for us to keep your pet alive. But all these are just the basic traits. It's what you take afterwards and use it for is what's going to make you a great animal health technologist.